Hi! Ay, mali. Ulit. Ulit. Magandang buhay, mabuting tao. So, welcome back to my YouTube channel. Oh, late itong intro ko eh. So, ayun. Ipapakita ko sa inyo yung mga kaganapan ko kahapon.
Share mo lang?
During my preparations before the actual live return demonstration on applying of nasal cannula and ECG or electrocardiography. Wow! Tapos, ano ba? So, yun. Yun lang naman. Abangan nyo sa mga next clips ko. Bye! Hi guys! So, nag-prepare ako para sa last jam namin bukas. And, nakapag-prepare naman ng iba. So, papakita ko sa inyo yung mga ginagawa ko. So, nagkakang salamin kasi hindi ko makita yung phone ko pag nasa malayo. So, ito yung ECG machine. O, diba? Tapos, itong ECG sticks, hihilain na lang yan. O, perfect. Tapos, ito yung mga electrodes. Kaya, nag-print na lang ako. Hindi makita. Kasi, ayun, kailangan natin mag-improvise.
Wow!
And then, for the nasal cannula, o oxygen tank natin yan, o, diba? Pero parang lang tayo para makasurvive ko sa yan. Yes! Ay! Kaya mo pa. Ayan. So, magpa-practice ako ngayon. Kasi bukas na yung random namin. So, pinaprepare ko lang yung mga gagawin ko. Magulo, diba? Ganito pag-rap na it's magulo talaga. Since kailangan i-adjust yung mga gamit ko dito sa kwarto. May anak siya. Tapos, pulse oximeter. Diba? Kita naman siya. Tapos yung nasal cannula. Ayusin natin. So, hindi ko siya malalagay sa tenga niya. Ito dito na lang. Assume na lang sa tenga malalagay ko sa kanya. Kasi, tapos yung chart ko, aray ko, for documentation. And then yung alcohol for hand hygiene. Magpenta tayo mga Mars. Chart. Ayan. Okay. Ba't hindi na lang? Kasi hindi ko usap yung scrubs ko. Hindi ko pa nilalagyan para ng double-sided itong electrodes. So, I'm back again. I'm stressed. Char! Joke lang. Ito lang kasi medyo challenging pag-rat them sa pag-prepare ng mga gagamitin. Aray, gusto na lang higa. Char. Tapos may research pa, di ba? Oh, mock seal. Okay. Saan na ako mag-uumpisa? Okay, start tayo. May isa kanya na. Oxygen therapy. Okay. Good morning, ma'am. I am Angelica and I am a student nurse in charge for today. May I know your complete name and birthday? Ay. Hindi ako na-prepare, so ulit ako. Ayusin ko. Sorry na po. Yung cotton sauce. Kunti na yung cotton balls ko. Ako. Ang gamit ko dito. Kunin ko yung fibrillation. Aha! So, may alcohol na to. Lagyan na lang natin. Para prepare na. Ow! Prepare na siya. So, doon na sa after oxygen therapy. Ano ba yung procedure ko sa oxygen therapy? Pwede ko may kulang. Wala. Mabilis siya. Yay!
Sana
Okay.
all.
So, we're done with the oxygen therapy. Now, I need to record an ECG, which is an electrical trace of your heart. This procedure involves placing some sticky pads onto your chest and knees, which is connected to the ECG machine sleeve to record the tracing. Do you have any clarification? So, ayun. Tapos ko lang i-practice, pero medyo hindi pa ganun kayo sa yung flow, pero nasaan na siya. 85%.
Wow!
Ayan, ganun, malapit na. And okay naman na siya. Doings with script, okay naman na siya. 85% yung progress. Practice ko lang ng i-practice. Para practice makes better, diba? Grabe, makalat po ulit dito sa kwarto ko dahil in-adjust ko po yung mga gamit ko para makapag-practice po ng maayos, tapos mamaya alisin ko ulit kasi ginawa ko po yung kama ng kapatid ko kasi mababa po yung kama ko. Kakain lang po ako and then practice na ulit. Ay, buti na lang hapon yung red dem bukas kasi tomorrow morning po binigay ni Sir Dennis yung time para po mag-record kami para sa research namin. So after recording po ng video presentation sa research, then naayusin ko na po yung mga gagamitin ko dito. Yan lang. So yun, I'm back again. Diba? Same angle lang. And tapos na tayo sa, nung umaga is, wala akong clip sayang nung video presentation namin, nung research. And then, after lunch po, 1 p.m. is, live return demo. So yun. Diba? Yun. So, after ng research, video presentation, palit agad for red practice. Kailangan mo na agad. Okay, so hi guys. So, malapit na ang red dem. Schedule siya ng 1 p.m. and 12:45 na. 12:45 na siya. So, kabado na ako. Pero nakapag-practice naman na. And hopefully, maging okay yung flow during the actual live return demo. Sana hindi tayo ma-mental block ng mga Zai. So, babakita ko yung setup ko sa inyo.
Sure mo lang?
So, wait lang, okay? So, ganito yung setup ko. Ito yung mga gagamitin for the nasal cannula and ECG. So, dahil pagsasabayin na namin yung dalawang procedures. And then, siya si patient ko. Ayan. Buti na lang loyal siya sa akin. Hindi niya ako tinatagwil. And ito yung oxygen tank and then humidification with oxygen flow meter. Ganyan. So, since wala tayong gamit din, improvise na lang. And then, dun ko ilalagay po yung camera ko since I don't have tripod. So, dyan ko ipi-place para makita yung angle. Okay. And then, yun lang naman. Tapos, ito pala, sa pagdating sa ECG, ayan kusot na siya dahil nakailang practice na ako and tinamad na ako mag-print ulit. Okay. So, ayan. Diba? Tapos, ito yung mga electrodes natin. Nag-print na lang ako. And then, nilagyan ko siya ng double-sided tape para dumikit siya sa teddy bear. Okay. So, yun lang naman so far. Time check. 12:48. 12 minutes to go. Kinakabahan ako.
Bruh.
So, wala akong magiging record ng live red dem. Pero, nag-video na ako kanina para sa ng red dem ko. And then, diretso yun. Walang cut yun. So, from nasal cannula then shift agad. Proceed agad sa sa ECG. So, yun. Kabado na ako. So, I'll be right back, guys. And prepare lang ako para sa 1 p.m. red dem. Bye! Ayan, habang na tayo sa gymit. 12:52 na. Mamaya pa tayo papasok ka na una. Wala pa si Sir. Kabado na ako. Kabado na yan. Mukha ng kabado. Wait lang. Yung itsura ko kabado, nanginginig oh. Sana wala akong makalimutan during red dem. Oh my gosh. Pag mag-join ako, kailangan kasing host. Wala pa si Sir. Help me. Ito na yung pasyente ko. Diba? Pasyente natin siya. Hi! Come on. Hi! Pasok na tayo. Hi! Batch 1 kami under Sir Dennis. Waiting for the host to join. Papa si Sir. Lang ka batok. Batok. Kanta muna tayo habang inaantay.
Wow!
Wherever you go, whatever you do, I will be right here waiting for you. Whatever it takes, or how my heart breaks, I will be right here waiting for you. Sure, di ko alam yun eh. Sorry, pagpasensya niya kung mali-mali tono ko.
Bruh!
Hindi ko kabisado. Pero ako na-practice. May na-practice na. Yes po, sir. Sige po. Good afternoon. Now I'm going to perform applying of nasal cannula and ECG. Good afternoon, ma'am. I am Angelica and I am the nurse in charge for today. May I know your complete name and birthday? Okay, thank you. This is to ensure patient safety and reliability of the patient's identification process. Okay, so I'm going to assess your respiratory status. Going to check your lung sounds. Breathe in, breathe out. Breathe in, breathe out. Thank you. So, do you experience difficulty breathing? No. Okay, so ma'am, please cough. Okay. This is to prevent aspiration. Okay, so now I'm going to check your oxygen saturation using pulse oximeter. Don't worry because this is painless. The purpose of pulse oximetry is to check how well your heart is pumping oxygen through your body. Okay. Then, review the medical record for medical order of oxygen, noting delivery method, flow rate, and duration of oxygen therapy. Ma'am, this procedure delivers oxygen to your body and will help you breathe. You can receive oxygen therapy from tubes resting in your nose, a face mask, tubes placed in your trachea, or a windpipe. So this treatment increases the amount of oxygen your lungs receive and deliver to your blood. So you don't have to worry because this is a non-invasive procedure and it will make you comfortable with your breathing. Do you have any clarifications before we start? No. Okay, thank you. Then perform hand hygiene. Then attach the oxygen delivery device to oxygen tubing and attached to the humidified oxygen source, adjusted to prescribed flow rate. Okay, ma'am, I will now insert the nasal cannula in your nose. So please tell me if you feel any discomfort, okay? Okay, is it okay or is it tight? Okay, it's okay. So assuming that the nasal cannula is hooked on the external ears of the patient, since my patient's head is too big for the nasal cannula to fit in. Okay, so then maintain sufficient slack on oxygen tubing and secure to patient's clothes. Okay, so next is to observe for the proper functioning of oxygen delivery device. So for the nasal cannula, make sure that the tips are positioned properly into the patient's nares with the humidification functioning. And then next is to verify setting on flow meter and oxygen source for proper output and prescribed flow rate. Then check the cannula every 8 hours and keep the humidification container filled at all times because the humidifier releases moisture. Some fractions of the molecules of the oxygen in the air would be displaced by water molecules, compromising the natural oxygen and nitrogen mixture that we breathe in. Okay, so I'm going to check again your oxygen saturation. How do you feel right now? Going to check your lungs once again, your vital signs. Breathe in, breathe out. Breathe in, breathe out. Thank you. This to evaluate the effectiveness of oxygen therapy. Then check the adequacy of oxygen flow each shift. Okay, ma'am, so do you feel any itching or irritation on your ears? No. Okay, so let me check, okay? If there's any redness or swelling. Okay, thank you. Just down. Then, lastly is to make relevant documentation. Okay, ma'am, so we are done with the oxygen therapy. Now I need to record an ECG, which is an electrical trace of your heart. This procedure involves placing some sticky pads onto your chest and limbs and connected to the ECG machines lead to record the tracing. Do you have any questions? None. And then provide the client privacy. So assuming that I have here my curtains for the privacy. Then perform again hand hygiene. Then place the ECG machine to the client's bed and ensure it is functioning. Okay, ma'am, so please relax your arms and legs to minimize the muscle trembling. Okay? And which can cause electrical interference and also for better tracing. Okay, thank you, ma'am. Also, I will wipe the excess oil and dirt on your skin using alcohol and cotton swabs. Are you comfortable with that? Okay, thank you. So remember to avoid shaving because this can cause microabrasion. Then expose the client's chest and limbs. So now I'm going to place these sticky pads on your chest and limbs. Stay calm and relax. This will be quick and easy. So for the V1, it is placed on the fourth intercostal space, right sternal border. The next, V2, fourth ICS, left sternal border. The next is V4, fifth ICS, mid-clavicular left. V3, midway between V2 and V4. Next is V6, fifth ICS, the mid-axillary. And then V5, midway between V4 and V6, anterior axillary. The next is on the limbs. Make sure to select flat and fleshy areas because tissue conducts current more effectively than bone, which produces better tracing. Okay, ma'am. So I need you to lie still and don't talk during the recording. So please relax and take a deep breath. I assure you this will be quick and easy, okay? Thank you. Then press the auto button and observe for the tracing quality. Then turn off the machine. Okay, so now we're done. How do you feel? Okay, thank you. I will now remove the electrodes on your skin. Okay, thank you, ma'am. Then assist the client on her comfortable position. Okay, thank you, ma'am. Then perform hand hygiene again.
Secret! Baka malaman nyo.
Then document the past date and time, including the significant responses of the client. So verify the date and time, client's name, and the assigned ID number on the ECG itself. And then note any appropriate clinical information on the ECG. That's all. Thank you. And yeah, we're done. Sa lahat ng mga naka-schedule na activities ngayong araw. We're done with the research video presentation. Hopefully, maging smooth yung defense next week. And then, ngayong hapon naman is yung live ret test for P3. Oh, thank you Lord. And natapos na ang mga activities natin for today. And marami pang gagawin. Pero, laban lang. Padayon lang kahit nakakapagod. Sabi nga, hindi mo mararating ang isang bagay na minimilihi mo kung hindi ka dadaan sa paghihirap. Siyempre, lahat ng mga paghihirap mo, lahat ng mga sacrifices mo, kita ni Lord lahat. And it will be worth it in His perfect time. And ipapakita niya rin yung rason kung bakit tayo nahihirapan dahil magbubunga lahat ng ito. So, let's keep moving. Let's keep fighting. And hindi tayo nag-iisa sa laban na ito. So, padayon to all future nurses. Laborn lang. RN 2023 by God's grace. So, yun lang po ang aking masasabi. And this is the end of my vlog. And thank you for watching. God bless you all.